Good afternoon, everyone. My name is Kristen Bernhardt, and I'm the Senior Vice President for Advocacy and Policy here at the Ounce of Prevention Fund. Thank you so much for joining us this afternoon for the webinar about the Ounce's new policy paper, Expanding High-Quality Childcare for Infants and Toddlers, Lessons from Implementation of Early Head Start Childcare Partnerships in States. Thank you to those who have already chimed in to complete our poll to help us understand a little bit more about what states are considering across the country when it comes to improving childcare for infants and toddlers. It's probably not much of a surprise to people to know that the top issues coming in on that poll right now are around quality and affordability. And in that case, you are in the right place this afternoon for this conversation and are in for a real treat when we'll hear from our state leaders in just a moment. It really gives me great pleasure to talk about this new policy brief today. I, before working at the Ounce, worked in the state of Georgia and helped lead implementation of a state early Head Start Child Care Partnership grant in Georgia. It's also great to see attending today some of my old colleagues and peers who are also critical for that work in our state. So a little bit about the Ounce as we get started. The Ounce of Prevention, if you're not familiar with our work, works across really a 3- or 4-legged stool. We think about our work in direct service, in programs, as a Head Start grantee, a provider of professional development across the state of Illinois and across the country, a research team that does deep work around research and evaluation for high-quality early childhood systems and programs, and policy and advocacy. Across our stool, we think that this is the secret sauce when it comes to ensuring that all children in our country have the best chance for success when they are at the age of 5. If you're not familiar with our founding, we began in 1982 here in the city of Chicago, but now it works nationally across a network of over 23 states who are part of our policy and advocacy network, with educare schools across the country, but maintaining our deep historical connections here to the city of Chicago and the state of Illinois. I'll share with you a little bit about what our intentions are for this webinar today. We will hope that by the end of this hour together, we'll increase your understanding of the impact of early Head Start child care partnerships on broader state systems and policy, share knowledge around state approaches, challenges, and recommendations for improving quality in infant and toddler care, and identify promising actions for increasing access to high-quality care for our youngest citizens. Now, how we're going to do that with our agenda today is we are wrapping up on the introductions of the framing of this webinar, and I'll introduce our other panelists that you'll be hearing from shortly. We'll share about the Early Head Start Child Care Partnerships and the report that we just issued and the findings, and then the real treat, hearing from our state partners in Maryland and Alabama, and recommendations and resources. We think about how to move this big issue forward, both around the actual partnerships and the lessons learned from them, but also around increasing access and quality for childcare for infants and toddlers around our country. If at any time you need assistance during the webinar, please don't hesitate to chat us in the Q&A box or in the chat box, and we'll make sure that we address whatever needs you might be having throughout our time together. And of course, we'll have time at the end for questions too, so please keep them coming. With that, I'm pleased to turn it over to Margie Wallen, our Vice President for National Policy here at the Ounce.
Thanks, Kristen. I'm so excited to share with you some of the findings and results of our paper. The Early Head Start Child Care Partnerships Program, the Early Head Start Child Care Partnerships Initiative was launched in 2014, not only to directly serve thousands of infants and toddlers and their working parents earning very low wages in high-quality child care centers and family child care homes, but also to promote more seamless birth-to-three systems across early care and learning settings in states and even across the federal landscape. 5 years after round 1 of Early Head Start Child Care Partnerships implementation, we wanted to better understand the impacts of the partnerships, which are part of an almost $800 million investment available for the partnerships and Early Head Start expansion. and particularly whether and how the partnerships have influenced child care policy changes and systems reforms in states to improve access to high-quality infant and toddler child care for families farthest from opportunity. We're excited to share our new policy brief that helps to answer those questions by telling the stories of the impacts of the partnerships in 6 states: Alabama, Georgia, Louisiana, Maryland, Oklahoma, Washington, and the District of Columbia. It's our hope that the policy strategies we highlight will serve as examples to advocates and programs and systems leaders in states across the country about what's working to enhance program quality in child care centers and family child care homes. Not only to those children who are eligible for the partnerships and participate in them, but also to the thousands more children who are served in those settings who are benefiting from a ripple effect of partnership resources, such as upgrades to program infrastructure like play spaces, purchasing and training on evidence-based curriculum, and professional development supports for teachers and family support staff. We're also hoping that the findings in our report and the other resources that the ounce and our colleagues in the Educare Learning Network have developed on early Head Start child care partnerships will prove useful to hopefully many of you who are potential applicants for a new round of early Head Start child care partnerships and early Head Start expansion funding. There's $100 million of new money in the federal budget, and so we're hoping to see a round 4 funding opportunity announcement come out very soon. We know that in today's economy, when having both parents in the workforce is an economic necessity for families, affordable, high-quality early care and learning is more critical than ever. Child care providers in our state, in every state, make near poverty-level wages, and parents, especially working parents earning very low wages, can't afford to pay the cost of high-quality care. In its current form, the financing for America's child care system is essentially broken. The quality of services is inconsistent at best. Major funding streams established to support the healthy development of our youngest learners and to support families who are working or in school serve only a fraction of eligible families. And of course, we all know that our systems are very fragmented and confusing. Families often don't know which programs they're eligible for, nor how to find the services that really meet their specific needs. Because child care, Head Start, and early childhood special education are governed by different policies, it's also very hard for early learning programs across funding streams to partner together to effectively serve the families in their communities. These are all issues that early Head Start child care partnerships are really designed to address. So now let's look at the challenges around infant toddler child care that you all prioritize and are confronting in your state. And Kristen sort of called out, but here's our final results around affordability, quality, availability, little bit around the continuity of care that we've been working across the field for many years to address. We're going to share with you strategies about how the partnerships address all of these, the challenges, and particularly around quality, because the whole program was really designed to improve the quality and really put resources forward to support what we know are inputs for quality that improve outcomes for children. To learn more about the impacts of partnerships in the states, the ounce conducted interviews with state leaders in Alabama, the District of Columbia, and Georgia, who actually administer a grant on a statewide level. So these are government agencies who are early Head Start child care partnership grantees. We also talked to state administrators in Louisiana, Maryland, Oklahoma, and Washington who worked very hard in their states to support implementation of partnerships by other grantees, and they did not have sort of a grant in their state. So we wanted to give you sort of some examples and the stories from a range of states. The partnerships were designed to build on the long history and prolific research on the benefits of early Head Start. The program offers child development, family engagement supports, and mental and physical health services that have resulted in children performing better on a wide range of cognitive measures, having better social skills, and exhibiting significantly fewer behavior problems, as well as families having more positive parent-child relationships, more stable and healthy home environments, and less involvement with the child welfare system. In partnerships, early Head Start grantees, which can include states, tribes, cities, child care resource and referral agencies, and a wide variety of community-based organizations, work to build the capacity of child care partners, whether it be at these centers, family child care homes, network of homes, to improve the quality. One of the key contributions of the partnerships was the federal guidance to states and grantees about how Head Start funding can be layered with child care assistance funds to significantly increase resources to providers to serve infants, toddlers, and families. Some of the characteristics of early Head Start child care partnerships. Early Head Start is federally funded and locally administered, really designed to meet the unique needs of communities. 7 of the partnership grantees are state government agencies, but currently there are over 275 grantees, partnering with almost 1,500 local child care centers and 1,000 family child care homes. We know from the National Descriptive Center of Early Head Start Child Care Partnerships that was released last year, as well as an implementation study that we did of partnerships across the Educare Learning Network, that partnership programs take many forms. The number of community partners vary, as do the number of early Head Start slots, geographic distances. We have a lot of continued learning to do about what the models from the partnerships and what seem to be most effective for improving quality. Many of the partnerships also are really implementing innovative strategies. They're designed to work with homeless shelters, child care centers and homes serving English language learners, agencies serving infants and toddlers involved in the child welfare system, and those serving children under 3 with developmental delays and disabilities. These data on this slide give a sense of the scope of the Early Head Start Child Care Partnerships program and its direct and indirect impacts. I'd like to just highlight the statistic that more than 8,000 teachers have benefited from enhanced professional development, coaching, training, and higher education opportunities. And I know that Stephen and Jennifer, as we move to hear the stories of Maryland and Alabama, will talk more about what that's meant to increase the supply of credentialed infant toddler teachers in their states. So now I'd like to turn it over to Jennifer Connell from the Department of Human Services in Alabama, and ask Jennifer if you would share a little bit about Alabama's context and what some of the key successes and challenges have been in Alabama relative to the partnerships.
Well, good afternoon, everyone, and thank you for the opportunity to serve on the panel today. The Early Head Start Child Care Partnership Program has had a positive impact in our state here in Alabama. And to give you a little background, the Alabama Department of Human Resources is the lead agency for the CCDVG, including the Child Care Subsidy Program, as well as the Quality Initiative. And we are also the entity in our state that licenses and monitors child care facilities. So in 2015, our agency was very excited to receive the partnership grant in the first round. and we are funded to serve 566 infants and toddlers throughout 25 of the 67 counties in our state. Our agency uses a hub model for the partnership program. So we partnered with 7 local agencies that were already implementing early Head Start and Head Start services through their own grants. And those 7 partners went out and recruited child care centers in their respective communities to serve as EHS-CCP partnership sites. And we currently have 6 of those partners remaining, and we have 18 centers that are caring for 344 of our children in the grant. In our state, a large number of infants and toddlers are cared for in family child care homes, particularly in rural areas of the state, which we have a lot of here in Alabama. So it was very important to our agency to include family child care as an option in our partnership program. So we partnered with Auburn University to serve as a statewide family child care hub for the partnership. The university already had a quality initiative program that was funded by us to mentor family child care providers and help them obtain accreditation through the National Association of Family Child Care. And so we had already felt like they had such a good relationship with family child care providers in our state that we felt that was a perfect fit. And currently, they are partnering with 44 homes throughout the state, and they're serving 222 of the children in our grant. So 5 years ago when we first started, right away we faced challenges in implementing this partnership program that we had to overcome. First, we had to figure out how we were going to leverage these multiple funding streams in order to support the high quality that's required by the program. The Head Start performance standards are much more advanced than our state's licensing standards, and so we had a large step to take there in meeting those Head Start performance standards. So one important goal for us was to support continuous access to high-quality infant toddler care for low-income working families. So in our initial grant, we determined and said that 80% of our families would also be participating in the child care subsidy program. We knew that providers would need that subsidy funding in addition to what they were already receiving contractually through the partnership in order to provide the higher quality that we were requiring with the partnership. So this meant for our child care centers and family child care homes, it meant lower staff to child ratios, smaller group sizes, environmental health and safety improvements, and pay for qualified teachers with a minimum of a CDA. So at that time, we had a big problem in that we had a very extensive waiting list of participants trying to get on our subsidy program. So to overcome that challenge, we revised our subsidy policies and created a priority category just for early Head Start eligible children and their siblings. And by doing that, that allowed us to serve these children immediately and enabled us to ensure that at least 80% of those partnership children were also participating in the subsidy program. So we worked in that way to layer in those funding streams. We also had to further align our subsidy policies in order to comply with the performance standards, which states that families cannot be charged any fees to participate in the program. And at the time, we had co-pays that were required for some people that were close to 100% of the FPL that were a little bit below. So we waived those co-pays for the EHS families in the partnership, but that's one way that we've been able to link that one small change throughout the state, because since then we've been able to wipe out our co-pays and no longer charge a co-pay at all to any family that is at or below 100% of the federal poverty level. And that is, of course, for all subsidy participants, not just the EHS now. If they are at 100% or below, they no longer pay a co-pay. So that was one of the things we were able to adopt statewide. We also knew that it would be a hardship on providers if the partnership families lost that subsidy funding. So if we promised them that 80% of their slots, those children would be in subsidy and they would layer that subsidy funding, if the family no longer qualified for subsidy, we knew that would be a loss of funding to maintain that increased quality that we were requiring in the partnership. So to overcome this challenge and maintain that continuity of care, we set aside a portion of our Early Head Start funds to pay providers the subsidy amount for those families that were no longer eligible for the program. So we set aside enough funding to be able to cover up to 10% of our funded enrollment of children that were eligible and on the subsidy program when they entered our program, but then for some reason, if it was job loss or now the parents made too much, we would be able to cover that. And so far, that 10% has been adequate to cover that continuity of care for our providers. In addition to leveraging multiple funding streams, we also needed to leverage multiple state systems in order to be successful. So one way that we did that is we partnered with the Alabama Department of Public Health to provide care coordination services for our partnership children. So the Alabama Department of Public Health has social workers that work within this care coordination program that helps identify any barriers that might be preventing the child from being as healthy as possible. So this program helps us ensure that each child has an updated medical home, health insurance, and is up to date with our state's EPSDT program. Additionally, we established a partnership with the Alabama Department of Early Childhood Education to provide coaching and instructional support to our teachers and family child care providers. And that program has been very successful. We've also partnered with the Department of Early Childhood Education to tap into the child assessment system that's used by our state's pre-K program, which is operated by the Department of Early Childhood Education, and so we were able to partner with them to tap in and use the same child assessment tool. Another need that we found from the very beginning was the need to build the supply of a qualified infant and toddler workforce. The partnership requires teachers to have a minimum of a CDA, and that could be for center-based, an infant toddler CDA, for family child care, a family child care CDA. But our state's licensing minimum standards only required a minimum of a high school diploma. So in Alabama, it's difficult to find an infant toddler workforce that already has the CDA. So we set aside some EHS funds to assist teachers in obtaining that credential. And we also partnered with our quality initiative that we had already funded with our TEACH scholarships, so that we could also, and that was funded through our quality initiative with our CCDBG, so that we could also tap into that resource as well if the EHS funds that we had set aside were not enough to cover all of those teachers being able to obtain a credential. So that was something that we had to work through. And so overall, the partnership program has allowed us to increase access to high-quality infant toddler care in the state. And it's allowed us to experiment on some reforms on a smaller scale first, before we saw if it was something that we could implement statewide or on a larger scale. So those are some of just the basic challenges and ways that we came to work around them, and successes that we've had with the partnership. And we've been very grateful to have the opportunity to serve the infants and toddlers through that program.
Thank you so much, Jennifer. You've given us so much to think about, from all of the interesting partnerships that you formed with Auburn University and across your state agencies, the many policy reforms, and really one of the themes, I think, in all of the state profiles is the ability for the partnerships to really almost provide a small pilot and a way to try out and assess policy changes that then ended up to be so successful, and additional funding became available, either with a combination of state and federal funding in child care that allowed many of the states to implement some of these changes statewide. Stephen, really interested to hear from you now, and have you lift up some more of these themes as you tell us the story of Maryland.
Great. Thank you, Kristen and Margie and everyone at OUNCE. Really appreciate this opportunity, and thank you for the great report. Reports like this are really helpful for states in getting innovative ideas and also already seeing what kind of things work in one state or another. And thank you, Marjorie, for sharing all these great ideas. Jennifer for sharing all these great ideas. I'm jealous that we're not a state recipient of the Early Head Start Child Care Partnership, but I feel that it doesn't really matter for the most part who the recipient is, as long as children and families have greater access to high quality infant and toddler care. But I do see some definite parallels. I like, Jennifer, how you shared with the model of the hub. I think that's really something that we can replicate in Maryland, as we are not a grantee, but that we could support, because we have a network of family support centers. We also have a network of Judy Center early learning hubs, and these hubs and support centers work throughout the state to kind of do a similar task in supporting early childhood programs and supporting families. And it could, just with a little tweaking, they could do a lot of what it's created in the Early Head Start Child Care Partnership. I also saw a lot of parallels in what you shared about the need to cobble together additional funding. I was actually in the administration when my colleagues at the Department of Health and Human Services were creating this program under the Obama administration, and we knew right away that this funding was really not going to be sufficient to meet quality. And that's why I think either a state grantee or a state partner is so critical to the success of this program. It can't be done just by this funding alone, as we know it in most everything in early childhood. And it's so important that states are fully vested in connecting with not only Head Start and Early Head Start, but of course these partnerships, and that's what Maryland has done. So we also support these Early Head Start child care partnerships, not only with the child care subsidy program, which we've rebranded as Child Care Scholarships, but also in terms of some quality funding that we've leveraged from our CCDF funding to meet our quality 3% set aside for infant and toddler age children. But I think cobbling those together are very important. We have 4 grantees now in Maryland. We just added a new one, and the total funding for those is about $5 million. But with the state funding, we add an extra almost $1 million in our quality funding from CCDF, and then about $1.2 million currently in our Child Care Scholarship program. But I think cobbling those together, we have grown from a $5 million of support to about a little over $7 million, and that's really critical for the cost of quality. I want to share a little bit about Maryland's context for you. We are fortunate in Maryland, I think, to have consolidated a couple years ago all of the major early childhood programs under one roof, under the Department of Education. And while I don't oversee the early intervention and special education, my colleague one floor below does. So we have lots of opportunities to collaborate and coordinate, since a lot of the kids are the same in our 2 programs. In addition, we oversee the state pre-K program, the collaboration office for Head Start. My wonderful colleague, Tressa Hanna, has done a great job of educating me on Head Start, Early Head Start, and of course the partnerships which she oversees. And then we have our Office of Child Care with licensing, credentialing, the Maryland Excels Quality Rating and Improvement System, and the Child Care Subsidy or Scholarship Program. And then we have other support programs like the Judy Centers, the Family Support Centers, the programs to support infant, early childhood mental health, and family support initiatives. But some of the things that we've done in Maryland at the state level to support these Early Head Start child care partnerships are, as I mentioned, leveraging some multiple funding sources, so our child care subsidy, our CCDF, to really meet that need for quality. Another thing that we've done is use contracts. Now, Maryland really doesn't use contracts at all with our child care subsidy program, our scholarships. Those are given out, centralized from the state, and given as vouchers to families that are eligible, and they have their voucher and their copay, and they take that to the provider of their choice. But we haven't really used contracts except with the Early Head Start Child Care partnerships. And of course, that has been very helpful for continuity of care, ensuring that those programs like family supports, family child care programs, home providers are supported and have a consistent and sustainable funding source for their programs, and enabling us to ensure that those programs don't go out of business, really, and that they're able to sustain what they're doing and really support a declining workforce in our home care providers that we're also working to really shore up. But I think it's also provided a model for us using these contracts in thinking about ways in which we could support the rest of the field in that way as well. So that's been helpful for Maryland, which really hadn't used this vehicle in the child care subsidy program before. We also have been able to raise what quality really means through our quality rating and improvement system, Maryland Excels, to have a specific track for Head Start and Early Head Start to attain those higher ratings of quality, which ends up also meeting additional funding because we have our tiered reimbursement system. And then we've built a career pathway for all of our providers and educators, but it specifically supports the Early Head Start Child Care Partnership participant educators, in that we have a provision two ways: the credentialing program, which has levels of 2 through 6, that at the higher levels gives an annual stipend to those teachers. At the lower levels, it's a one-time stipend. And then in our child care career and professional development program, we have our opportunities for educators to attain higher degrees, so an AA degree and a BA degree. And we cover the tuition, much like the TEACH program, but this is just separate from that. Our own branding in Maryland. We like to kind of do our own thing here in Maryland, but it provides for the tuition, the educational fees, and also all the books and materials for those students getting an AA or a BA degree. And we now are going to extend those supports to include the partnership we have with the Council for Professional Recognition in providing and covering the fees for teachers to get the CDA. Additionally, on the CDA, we instituted a new curricula for our career and technical education programs in attaining a CDA specifically for addressing the needs of infant and toddlers. And then we also have a CDA that we developed, curriculum we developed for the CTE programs for preschool CDAs. But of course, the infant and toddler one, as Jennifer mentioned, is a real shortage. So we're really trying to support that and highlight that as much as possible. The other things that I wanted to highlight were some of the challenges and the successes that we see. So Jennifer had mentioned about the support for rural areas, and this is something that's been really prevalent in Maryland. We do have some big cities like Baltimore City and Annapolis and some others, but a lot of Maryland is rural, and the Early Head Start Child Care Partnership provides the kind of support to ensure that we have greater access for our families to high quality care for birth to 3. And the partnerships really have ensured that. And it's provided opportunities that really would not have been there. In addition, some of the quality enhancement funding that we've provided from the state to supplement the federal funds have enabled increased teacher professional development, leading to higher degrees again, increased the skills through coaching, made sure that teachers had a focus on positive adult-child interactions, improved the assessments that we were able to conduct, including screening and formative assessments, helping with the building up a pool of coaches to support these teachers, and then helping these providers move towards greater and higher levels in our quality rating improvement system, Maryland Excels. This has been really critical because at those higher levels, with these children participating in the scholarship program, again, they also get that tier reimbursement. And those go directly to the programs to improve the quality of those programs. Now, some of the challenges that we faced in Maryland is recruiting qualified partners. We're still kind of in our infancy. We've only had early Head Start child care partnerships since 2018. So it's only a few years. It's still in our infancy. So we have a lot of lessons we're learning, but one of them is being able to recruit those partners and build their trust in that relationship. We need to do a better job of communicating those Head Start and early Head Start program expectations. The good thing in Maryland is we do really have very rigorous licensing standards. So it wasn't, I don't think, as much of a jump as it might be seen in other states, but nonetheless, they really are high standards, which is really the whole point of the program anyway, right? Higher standards of quality so that our children are receiving what they need in quality. And then finding qualified workforce, but also for the coaches, you know, those that can really support our teachers, and then making sure that we have enough affordable and adequate facilities to support the program. But again, I think those challenges are all things that are really helpful in a partnership with the state, because the state can really pave the way for additional funding, but also overcoming some of those obstacles and hurdles. So thank you again for the opportunity to share a little bit about Maryland's story, and you can read more of it, of course, in the report.
Thank you, Stephen. You highlighted also many of the findings from some of our other state interviews. Contracts, very much, you know, the benefits of using contracts. Very much appreciate your focus on how you integrated and, in fact, had the partnership inform your quality rating system improvements over time. Building those mechanisms to build community and alignment across Head Start and your child care provider communities, very important. Just wanted to kind of lift up, these were the key buckets as we did the interviews and looked across our findings. These were the key buckets and areas, and in the report you'll find much more specific policy and systems level strategies that were sort of leveraged in these categories. Stephen and Jennifer, just quickly, anything else you'd want to add before we sort of move on to get your thoughts about recommendations for states moving forward and also recommendations on the federal level?
I'll say one thing that I've been thinking about, and I was just talking to Teresa Hanna, our Head Start Collab Director. You know, I see this program, I don't know how it was exactly envisioned, whether it was going to be something that's just sustained forever, or if it was meant to be a pilot to show communities and states what's possible when you provide the kind of support that family home providers and center-based providers need to properly care for 0 to 3. But what I see it as is an opportunity for states to really see what works and pilot it and then replicate that. So we have in Maryland a great experience of getting federal funding for programs, implementing them, and when the funding runs out, figuring out a way to sustain them, either through redirecting current funding or getting the legislature to approve additional funding. And I could see the child care partnerships in the same way, whereas we really show the results of how this makes a difference, not only in those birth to 3 years and for families, but also in what happens when kids enter school and are on track for success later on. And if we can show that and the investment pays off, I think the state could then sustain this and expand it the way in which the state now has done that with the quality rating and improvement system, our workforce supports, and the pre-K expansion grants.
Thank you. Jennifer, anything last? Yeah.
I would just like to say that basically the premise of the Early Head Start Child Care Partnership Program is it all boils down to contracting for high quality slots. And so even if states did not have a partnership grant, they could easily replicate the model with their CCDBG funding just by, enforcing the quality standards of the Head Start performance standards and creating those high quality slots there. That's something that we have looked at as an agency in expanding ourselves. We have not moved in that direction quite yet, but it's something that we're exploring.
Just to elaborate a little bit on that, we heard that the states of Washington, Michigan are actually built in exactly what you just mentioned into their PDG Birth to 5 implementation grants. They built in piloting and using some of those PDG funds and state funds to scale early Head Start child care partnerships in other communities. So a very exciting strategy that we are hopeful other states will want to look at. Let's move now to, and I'd really like to get reactions and ideas from Stephen and Jennifer around these federal recommendations. Which do you find most compelling as you move forward in your state?
So for us in Alabama, definitely those that stick out the most to us are increasing the access to high quality child care by increasing the federal investment in CCDBG and also to increase the funding for the partnerships. We cannot implement the kind of quality that we're required to without those multiple funding streams, and so that's what stands out the most as what we need.
I would absolutely agree with Jennifer. It really, the country really needs to invest more in childcare and also these partnerships. And while I was really excited that there was additional funding for the Child Care Development Block Grant, in addition to the funding previously that was really historic, I wasn't head over heels celebrating. It's still not enough. We're not providing enough at the federal level for funding to support the number of children that we need to support. And states just don't have enough to carry it all on their own. And the federal government really needs to invest more in these programs. The other thing that I would add was the startup time. And I think, providing more startup time is really important because in order to implement a new program, you want to do it right. And it really, really takes a lot to ensure that the quality is there, the facilities are there, your workforce is there, and you really can't make those promises unless you have the funding to back it up. So I would say increased time for planning and starting up would be really important too.
Thanks, Stephen. That is an issue that we hear across program implementers of the partnerships. That 18-month window before you are potentially subject to a federal review has been very, very challenging, especially as you're working across lots of partnership slots and need to ensure that all of the teachers have CDAs. So that is something to advocate for in terms of a policy change. Moving on to some of the state recommendations that are included in the report, I'm wondering also, again, if the two of you will sort of pick out one or two and share your thoughts. Stephen,
So I'll go ahead and
go ahead.
Okay.
Sorry, go ahead, Jennifer.
I'm sorry, Stephen. So I would just say what sticks out to us most here with the state of Alabama is calculating that true cost of providing high-quality care at the Head Start performance standard level. So we know that it is extremely expensive to provide high-quality care to infants and toddlers. And that funding that we get from the EHS partnership is not enough. It must be layered with other streams of funding. And so not basing what it's going to cost on your market rate survey or any other thing that you use in your state, but calculating that true cost of quality is something that I would definitely recommend for states.
Great. Yeah, I would agree with that. I would also say that, states really need to find ways to break down some of those funding stream barriers, that might be in regulations. And, that there's a lot of there's different regulations for these different settings. And a lot of that actually is at the federal level, but then it's at the state level as well. So I think what's needed is state folks and federal folks to come together and look at those barriers at each regulatory lever to see where they can work the best. We're trying to do this with the Federal Office of Head Start around our pre-K expansion too, because I want to make sure that our Head Start providers are not left out as we move towards expanding universal pre-K for 3 and 4-year-olds in Maryland. But it's the same in our birth to 3 space, where we need to have the state funding regulations, the federal funding regulations be better coordinated and flexible as much as possible when the goal is really just to expand equitable access for families and children.
Thank you.
Well, with our final few minutes together this afternoon, we want to open up the line for some question and answers with our panelists, with Margie and myself. If you use the chat feature in the WebEx to pose any questions you might like to ask to any of the folks on the webinar today, if there are any we don't get to, we will certainly be happy to follow up with you via email, which we conveniently have because of the registration system. And while we wait for questions to come in, I'll pose a couple that I have as I'm listening to Stephen and Jennifer talk. And the first one that's honestly top on my mind is thinking about the implications of the partnership work for family child care providers. And one of the recommendations that we lift up in the paper is thinking about creating community hubs of support for family child care, which, Jennifer, you certainly talked about during your storytelling session with us. But I'm curious if both of you could lift up what are the lessons learned from this that are influencing the way you think about family child care in your state, not just within the partnership slots, but more whole scale about the unique needs of family child care providers to deliver high quality for infants and toddlers. Jennifer, since you went first before talking about family child care, I may turn this question to you first as well.
Yes, thank you. Well, I would say that one of the things that we quickly realized when we first started working so closely with family child care in this program is that they are so isolated, and it can be a time when our mentors and coaches would visit. They were just so relieved to, have another adult to share with and talk with about things that they were experiencing in their practice. And so we did find that it was very important for them to have that community of support. We have held quarterly listening sessions with our family child care providers throughout the state, where we go and they're able to tell us what are the challenges that they see with the partnership, what's working well and what's not. And so, we have always valued family child care, and we have a whole new appreciation now after working through the partnership grant for our family child care, and we know that they need that community.
I love that idea of quarterly feedback sessions just to create that open space to ask questions. Those feedback loops are so important. Stephen, any thoughts on your mind as you think about how this might have shaped the way Maryland approaches the unique needs of family child care providers?
Well, I think it's really important to be very specific in calling out our family child care providers. You know, often what they tell me is, you know, we kind of lump them in with everything else. We say early care and education providers or child care providers. And I think when people hear child care providers, they jump immediately to center-based care. And our community, which I'm really trying to strengthen with our Maryland Family Child Care Association members, I go to their board meetings, I go to their conferences. We have really candid, open dialogue with them to hear their needs. I think what I hear from them is just to really be explicit about calling out them as a setting. I mean, in Maryland, we have 8,000 licensed child care providers, and the majority of them are family home providers. So they really have earned and deserve to be explicitly referenced when we talk about child care and the needs of families and children in this state. So that's what we're really trying to consciously do.
Fantastic. Thank you so much. We have a question coming in through the chat box that's asked to both our friends in Alabama and Maryland about, have either of you calculated the per child cost of delivering high quality services that meet Head Start standards? And if so, can you share? The person posing the question really loves the suggestion to consider these costs separately from the market rate survey, as Jennifer, as you mentioned.
Yes, so when we did our last calculations, we were not able to continue them at the same rate as when we first started this partnership. And we weren't getting any extra early Head Start funds, so we padded it with funding from CCDBG. And so originally we were paying our family child care providers $150 a week and that's, you know, here in Alabama, and that was for 48 weeks out of the year. So when we got in there and saw what it really took to cover the 10-hour day, full year, and to have those qualified teachers and to have that environment, we saw very quickly in this past year when we renewed everyone's contract, we now pay $230 per week for 52 weeks out of the year. So in addition to that, they also receive, we started out with 80% were going to be also on the subsidy program, but now we say at least 60% are on the subsidy program when we did our renewal application. And so in addition to that fee per week, they are also given the full subsidy amount for all the children in their program that qualify on subsidy in the partnership. The full amount that they would normally get, and they're able to layer both of those to provide the qualified staff to cover that 10-hour day.
So we are, again, not a state grantee, so we're just supporting our various providers. But I would say that when I look at the funding and the number of children that are served in our 4 different providers here, or grantees here in Maryland, it really varies widely how much they're spending per child, and I suspect that those who are on the lower end are actually getting even additional funding they're cobbling together through local resources or philanthropy or in-kind donations, because typically I think that the cost per child from the partnership fund is pretty low and doesn't really meet what needs to be done for quality. And even with our child care scholarship, in addition, it comes to about $23,000 at the high end per child, but our grantees are telling us it's more like $32,000. So I think really the cost of care is going to be a lot more than what's in even the cobbled together funding from the state and the federal government, and they're seeking other financial resources.
Thank you, Stephen. Jennifer, in follow-up to your answer about the cost that you're using in Alabama, To derive the higher level funding that you're now paying, did you develop that number just in partnership with your partners directly? Did you work with a consultant or a national group that assisted in some of the cost modeling?
So our finance department here helped us work through the cost tool that you can find on, I believe, eClick, and we came up with that rate, and then we knew that we needed, in order to cover that 10-hour day, you really have to have, for your centers, you really almost have to have a third teacher to be able to cover, and because everybody has to be qualified that works in the classroom. And so when we calculated all of that into the cost of adding that third teacher per center-based classroom, that's how we arrived at the rate that we did.
Fantastic. Thank you so much. And it's great to have that internal capacity certainly right within your agency. Well, we're closing out on our time together this afternoon, so I just want to make available some additional resources. Of course, the full report, the snapshot, all the state profiles, both of Maryland and Alabama, but of all the state's profiles in the report, as well as a communications toolkit to help you share these resources more widely, are all available on our website. And it's a very simple URL, theounce.org/partnerships. And if you have additional questions about the reports, connections to any of the resources mentioned by our state panelists today, please feel free to reach out to any of us here at the Ounce, and we'll make sure you're connected with the resources that you need. To close us out today, we have one final question we'd love to send your way, which is, given all these challenges we've heard about, as well as the promising practices identified in the partnerships briefing from our state panelists, we'd love to hear from you about which of the recommendations from this paper seem most relevant to you in your context. If you go to the questions box on WebEx to the right, you should see all of the opportunities there for the questions that will appear on the screen in just a moment. So we'll leave the poll open as we're closing out our hour together, so we can continue to gather your feedback, which will help us inform the additional resources that come from the Ounce and from our partners around Early Head Start childcare partnerships. I especially want to thank our state panelists, to Stephen, to Jennifer, for joining us today, for the work they're doing every day in their state, and for the other state leaders who were featured in the paper. We are so appreciative of the work that you're doing for children and families, for childcare providers in the early education community, and to those who helped us put together this brief, this webinar, and are helping to make it increase access and increase quality for early childhood education for our youngest citizens. Thank you again so much for joining us, and we hope to be in touch with you all soon.